We're going to use our temporal hold, pay particular attention to the fluid, and follow it for a cycle or two, and then pay attention to the bones, the temporal bones themselves around their axis, and then pay attention to both of them simultaneously, and then follow the temporal bones in inhalation, flexion, to the end of their expression, and suggest subtly that they wait at that point. And as it goes back into exhalation phase, into extension, as it wobbles and comes back into flexion again, ask again to wait at that boundary. Again, remember, we're not forcing it. We're not creating a barrier for it. We are placing a suggestion, a subtle suggestion into the system. There's a tendency to narrow down because your intention is to create a still point. And so that can be a little bit intense. The intention can be intense. So you don't want to narrow down. You want to create a large space. And sometimes it's this dance between the boundary and your focus. I would say almost all the time, it's your focus that creates either an impediment or facilitates the potential for that still point. So create a very, very clear concept of the field and the edges of the field that you're holding and the movement of the fluids in the bone. You may even hold the ventricles in your field, and you can focus all the way down in the lumbosacral area and the midline, right into the ventricle system. And remember, do not force yourself into it. Don't compress it with your thought process. Don't crowd it. And as the system goes into stillness, just wait. It may be moments, it may be minutes. And then ascertain when the surge comes back and you feel the potency in the system. What is that quality like? Is it a stronger fluctuation longitudinally? Do you sense an energetic quality to the change? Was there a stronger manifestation of the potency of the system? That's your job, is just to witness, be present for the transformation that may or may not happen. Now, this is also very effective down at the sacrum, where you will basically do the exact same thing. You're going to follow it in flexion as the coccyx comes toward the ceiling, and then as the body of the sacrum goes into extension. And then you'll do this for a few cycles, and then as the coccyx comes up toward the ceiling in flexion, you're going to ask again for a still point, for stillness. So you do the exact same concept on the edges of flexion, on the edges of extension, and then ask, just as the system leaves extension to move into flexion, ask for a still point. You may feel, if it goes into stillness, a real sense of welling up in your hand.